If you need to visit a hospital in the United States, or if you want to work in healthcare, this video is for you. Today we will learn the English vocabulary to talk about places and people in a hospital. These are the terms I will go over in this video. Just a reminder that I'm from the United States, so a few of these words might be a little different if you're in an area that uses British English. Emergency room. ER. The emergency room is the area of the hospital you go to if you need care right away. It is most commonly known as the ER. Waiting room. The waiting room is the place you sit and wait to see a doctor or have a test done. Operating room, or OR. This is the room where surgeries and operations happen. Patient room. This is the room where a person stays when they have to stay overnight in the hospital. Intensive care unit, ICU. The intensive care unit is the area of the hospital where patients who are very sick stay to get specialized care around the clock. This is most commonly known as the ICU. Laboratory, or lab. This is the area of the hospital where medical tests are done. Imaging services. This is the area of the hospital where machines are used to see inside the body, like X-rays, CT scans, MRIs, and other tests like that. Pharmacy. The pharmacy is the area of the hospital where medicine is prepared and given out. Labor and delivery. Labor and delivery is the area of the hospital where babies are delivered. This might also be known as a birthing center. Postpartum care. The area of the hospital where mothers and babies stay after birth and receive care. The word postpartum means after birth. Chapel. A chapel in a hospital is a quiet place where people can go to pray and think. Wing. A wing is a section of a building. In hospitals, this is sometimes seen as an A wing, B wing, C wing, a north wing or a south wing, or a pediatric wing, a cardiac wing. Floor. A floor is a level in a building. Most hospitals have many floors. A star on the elevator shows the main level or the main floor. Reception. Reception is the desk you check in at when you go to the hospital as a patient or a visitor. Patient. A sick or injured person receiving medical care. Visitor. A person visiting a patient in the hospital. Hospitals have visiting hours, which are specific times that visitors can come. Some hospitals only allow 2 visitors at a time in a room. It's important to check signs in the hospital website to make sure you can visit the patient you want to see. Doctor. A person trained to treat sick people. Surgeon. A doctor who performs surgeries. Cardiologist. A doctor who specializes in the heart and diseases of the heart. If you see cardio or cardiac in a word, it means having to do with the heart. Dermatologist. A dermatologist is a doctor who specializes in the skin and diseases of the skin. If you see derma, it means having to do with the skin. Neurologist. A doctor who specializes in the brain and nervous system. Obstetrician, gynecologist. OBGYN. A doctor who specializes in pregnancy, childbirth, and women's health. Most commonly, we say OBGYN. Oncologist. A doctor who specializes in and treats cancer. Optometrist. A doctor who specializes in the eye and vision. Pediatrician. A doctor who treats children and teenagers. Physical therapist. A doctor who helps the body move better after disease or injury. Nurse. A person with special training to care for sick people in the hospital. Certified Nursing Assistant, or CNA. A person who assists nurses to provide basic care to patients. Pharmacist. A person who's trained to prepare and give medicine. Dietitian. A person who's trained in healthy eating. May also be called a nutritionist. Thanks for watching. Leave a comment. Let me know something new you learned in this video. Subscribe today for more English learning videos like this.